Hello, everyone. This is Dr. Live with New Insight, and thank you for joining me in another video. Please be sure to like, comment, and subscribe to the channel. I wanted to make a second video about ways to maximize your benefits in therapy, as well as answer 4 common questions about therapy. So let's get right into the discussion. Question 1. How long does therapy last? The length of therapy depends on the issues being addressed and the type of therapy modality being used. For example, CBT, or cognitive behavioral therapy, typically requires 5 to 20 sessions. However, solution-focused brief therapy requires around 6 to 12 sessions, typically. And the sessions usually last 30, 45 to 60 minutes. But therapy does take time. It's not a quick fix, nor is it a one-size-fits-all. The therapist must ask questions and make a very careful and thorough assessment to get an accurate understanding of the problem and to determine what interventions to put in place to address the problems. Question 2. Is it ever too late to begin therapy? It is never too late to start therapy to address the problems, issues, or concerns you want to change or improve. However, there are times when an issue has reached a crisis point or has persisted for so long until people's feelings and motivations have changed, making it more difficult in therapy, more challenging. And I see this most often in couples counseling. For example, although the person may still attend therapy, he or she does so out of fear, obligation, or guilt, or for the sake of saying they tried, when in reality, they have already checked out, already made up their minds, and have their intentions set on what they really want to do. They may desire to break up, separate, or divorce, and may already be dealing with someone outside of the relationship or marriage. Therefore, they come into therapy hoping to change the other person or get justification that the relationship is unhealthy or toxic, which will then give them a reason and or an excuse to stop putting in the effort. So they just basically show up for therapy with little to no attention, engagement, and participation in the therapy process. And he or she is basically just going through the motions. And this is why it is so important to be honest with yourself and the other parties involved. If you're not ready to change, don't want to change for whatever reason, you're not ready to face your issues, take accountability, and really start working on making changes, you would be wasting your time by going to therapy. Therapy isn't a waste of time, but you would be wasting your time if you're not in the right mindset. Also, I want to emphasize that it's never too late to change, but that doesn't mean you will get the outcome you want or desire. For example, in relationships, someone may have really made positive changes in, for example, managing their anger, showing their partner more attention and affection, communicating better. But that does not guarantee that the partner will give them another chance or remain in the relationship. Therapy isn't magic, and the change can go either way, on your side and the other people or parties involved. And sometimes it changes in a way that is different than what you wanted, and it changes in a way that in the present can look devastating and hopeless, but in the long run is a change that was very necessary and beneficial for your life and health. Question 3. Is therapy just talk? Absolutely not. But talking is a major part of it because you have to communicate to express your thoughts and feelings so the therapist can help you process. You have to communicate to facilitate a healthy dialogue. And again, this is why it's so important to always structure your therapy sessions. This is another point. You can't solve it all or get it all in one session. Write down the things you want to address and prioritize them, and the therapist will help you with this process as well. This is what the first session is typically about: getting an overview of the issues, sorting through to prioritize the issues that are most urgent or problematic, and then organizing these issues into specific goals with a plan of action, which would be your therapy or treatment plan. And remember, most sessions are 30, 45 to 60 minutes. And in that time, the therapist is trying to establish a working rapport with you to make sure you two will be a good fit, carefully assess the problems and issues, and oftentimes the therapist may need to complete paperwork, for example, for courts, social services, attorneys, schools, employers. They make assessments and diagnoses. And so in the first session, especially, there is more to be done than the actual talk therapy. And even in the therapy sessions, all sessions have a beginning, middle, and end. Issues need to be discussed. The therapist is assessing the whole time, asking questions, clarifying, confronting issues, listening, providing counseling. So all the sessions require traditional talk therapy, and some will require more structured skill building. But again, it just depends on the issues presented and the type of therapy being used. Also, if a therapist interjects in a session, it's not to be rude or disrespectful or because they don't care about what you're saying. And mind you, they should always do so in a respectful, professional way. But when a therapist interjects, it's to keep the session on track and to facilitate the session in the amount of time allotted. There's a lot for the therapist and a lot for the client to process. And so the information needs to be as organized and structured as possible. Question 4. How can talking help? It's healthy to express your thoughts and feelings. So many people internalize their feelings, which leads to anger, anxiety, and stress, even panic attacks, and other physical health problems. And many people don't feel safe being vulnerable. They don't trust others. Many don't have anyone they can talk to or anyone who understands or can give them proper, non-biased guidance. Also, when you talk, it helps you to process through your feelings, receive feedback that can lead to more knowledge and insight. And the process can help you with other unresolved issues or trauma wounds that you may not realize exist or realize have been contributing to your present problems. You talk and you learn skills. You learn to think in a different way, and you learn to form different, healthier habits. So there's no shame in seeking therapy. Don't minimize it or discount it. Mental health matters and is just as important as physical health. Every therapist is not for everybody, and everyone will have a different experience, just like with any other form of treatment. All you need is a growth mindset. Be ready to talk, face your fears, push past your comfort zone, let it all out, and be receptive to change and growth. So I hope this helps. Please leave your questions and comments down below and share your experience with therapy, positive or negative. And thank you for watching. We will talk soon.